Okay, the next set of muscles we're going to do are the adductors on the inside of the leg. AD. All right, so I'm going to unweight the leg. He's going to completely relax, of course. I have my support proximal to the knee joint. Don't forget to give that support. And the other leg is going to be the stabilizing leg. So as I pull him out into adduction, I'm pushing away so he's stable. Do you feel tight there, Matthew?
Yes.
And we're going to come a little bit further, and we're going to do this for 30-second hold. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So that's your manual static stretch. Now we're going to do the whole relax. So we're going to have those adductors contract isometrically. So we're going to go to the point of tightness. You feel tight there?
Yes.
Backing off 5 to 10 degrees towards adduction. And we're going to ask you, push into my hand towards the other leg. Good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. No, 10. Sorry, you're right. And then come out to 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. We're going to 10 both times, and I forgot the 30. All right. So now we're going to do an agonist contract. So we're going to make those hip abductors contract isotonically as we go into the stretch. All right, so come out to the point of tightness. Feel tight there.
Yes.
Back off more than that, 20 to 30 degrees. Now, I'm going to use this hand here, or you can use your body here, but just in case to help that knee joint stay safe, let me put my pressure here, and I'm going to ask him to push out towards me. Push, 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 push. Relax. Now I've got to stabilize and bring him out into abduction stretch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Good. All right. Just keep in mind, you want to keep the lower extremity not rotated out. Try to keep it as neutral as possible. When you saw my hand proximal to the knee joint, my arm was stabilizing his lower leg to keep it also neutral. So those are important. Okay, let's go right into the next one, shall we? You ready? We're going to do the abductors this time. I want you to go onto your side, onto this left side. So just roll onto your side. Okay. Come back towards me a little so I can have a better hold on your lower extremity. Okay, so now this was the Ober's test position. This is for your TFL IT band. Stabilization is important on the iliac crest. We're bringing the patient back to extension and allowing adduction to happen. This is where the stretch happens. So if your patient cannot drop into adduction, then you know that they need a stretch, and he does. So your stretch force, again, is going to come back into extension, and then we're going to pull down, and I'm using my body here. I'm pulling a little bit, but I'm using my shoulder, my body here, because I've got to stabilize his hip so it doesn't tilt, or it doesn't rotate, or it doesn't drop on the side of the adduction. So I'm stabilizing, coming down. You feel tight there, Matthew?
Yes.
And we're going to go a little bit further, and we're stretching for 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So that 30 seconds into adduction, that's important. Also, keep the hip into extension. Don't let it bounce back into that flexion as you're going into adduction. Now the one we're going to do is the hold relax. So the hold relax, we're going to have the actual abductors and the TFL contracting. So we're going to go back to extension. Okay, now we're going to, this is the point where I know when we go down is the stretch. So I'm going to lift and ask him to lift his leg towards the ceiling and give him resistance. So go ahead and come up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. I'm stabilizing and pulling him down into adduction for 30 seconds. 2, 3, 4, 5, 30. Okay? Just shorten it. All right. The last one is your agonist contract. So you're going to have the adductors working now isotonically before the stretch. So again, I'm holding on to his leg. Okay, in that Olber's test position. I'm coming back into extension. So now here we've got to go down to the point of tightness into adduction. I'm backing off, which is coming up as much as I can into abduction, and I'm going to ask him to pull down into my hand, pull down towards the plinth, pull, 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 allowing him to go, pull, 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 and relax, and now I'm stretching. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Okay. The other way to do it, if they need to do it, you know there's modified Olber's test position, so you can, if there's any compression on the knee joint, any patellofemoral pain, you're doing the same thing, but doing it in extension at the knee. Okay. This is also a good stretch for a patient just on their home stretch, as long as they don't rotate, okay, and do this. So this is a core position. Just allowing them to internally rotate and rest is not a stretch. The stretch is bringing them back into the plane that you want, neutral hip. So it has to look like that for them to stretch. Okay, so often this isn't a great thing for them to do if they can't maintain the position at home. All right, how you doing, Matthew?
Good.
Excellent, excellent. All right, so let's go on your belly and we'll go to rotation, okay? So the next stretch, I'm going to have you put this underneath your belly. So can you pop up on your hands and knees? Perfect. Okay, straighten out your shirt here, and we'll put towel at your head. All right, there you go. Okay. All right. The other towel, just shorten this towel a little bit. I want to clear the patella because we're going to do rotation. So I don't want the patella grinding into the plinth. I'm going to lift the leg a little bit. Cameraman, if you want to come this way. Okay, so we're clearing that patella. I want to keep them as neutral as possible. And my stabilization is going to be at the PSISs. Okay? Now, this is external rotation. Okay? So if I'm going into external rotation, I'm stretching the internal rotators. Okay? If I'm going into internal rotation, it wants to come out, I'm stretching the external rotators. Okay? So, for your, I'm going to start with increasing external rotation, which is the internal rotators stretch. Okay? So if I go into external rotation, I'm going to say, do you feel tight there? And he's going to say, yes. So I'm going to go a little bit further. Do you feel the stretch?
Yeah.
Okay, we're going to count for 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. All right, good. I'm going to let him rest a little bit. Feel that towel being clear? Kind of fudging the towel here for a bit. All right. That's a little bit more even. Okay. So now let's do our hold relax. Okay. To increase external rotation. So I'm going into external rotation. Feeling the tightness there? Yes?
Yeah.
Okay, and we're backing off a little bit, 5-10 degrees, and he's going to push into my hand towards me. So in the opposite direction. So go and push. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And we're going into the stretch. Getting a little more here. So that's good. 30-second hold. 1, 2, 3, 4, 5, 6, 7, 8, 30. All right, good. Okay, so I'm on the lateral side with the contraction, isometric. Okay, so now we're going to do our agonist contract, going to the point of tightness, backing off 20 to 30 degrees. Now I'm on the medial side of his tibia, and I'm going to ask him to pull towards his other leg. Okay, so pull towards your other leg. Pull, 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 pull. I'm allowing him to go. Good, and relax, and we're stretching. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Excellent. Excellent, excellent. Okay, so that was to increase external rotation. The next one we're going to do is to increase internal rotation. You see he doesn't have much more external than internal. All right, so we're going to come out to the point of tightness. You feel tight there? Yes? Okay, we're going to come a little bit further, and I'm stabilizing. We're going to count to 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. That's your manual. Okay. Now we're going to do our hold, relax. So we're going to come out to the point of tightness, back off 5 to 10 degrees, and now he's pushing from here to here. So I am pulling to give him resistance. So go ahead and bring your leg towards the other leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And I'm pulling into internal rotation, stretching. 1, 2, 3, 4, 30. And just shortening it. All right. So, just make sure I'm staying in neutral hip. All right, so now we're going to go back into that internal rotation to the point of tightness. We're going to do agonist contract. Okay? Back it off my 20 to 30 degrees. Now I'm going to ask him to push out towards me into my hands. So push out towards me. Push, 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 push. Keep pushing, keep pushing, keep pushing, keep pushing. And relax. And we're stretching. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Actually got a little bit more, if you can see. The tissue kind of responded that time. So good. And that's your rotation stretches.